I'm just getting our stuff ready. Exam number 3, 50 questions. It'll be same as every other one. But let's pull up. I have a PowerPoint like I usually do for the exam, so just pulling that up for you guys to take a look at as I go through it with you. Any questions before I start? No. You guys don't have to have your cameras on unless you want to. You still get credit. Okay. All right, so we have, I'll share it with you guys. We don't share this PowerPoint because we use it as a presentation technique. So, but I'll share it with you so you guys can see it. All right, so this exam covers lots of chapters, as you guys know. 11, 12, 6, 7, 8, 25, 26, on and on and on. All right, first topic we take a look at is community. So we know community is going to refer to people, place, person, function, right? Who's there, where are they, and what do they do as part of the community? Excuse me. When measuring our dimensions, we're going to make sure that we assess different data sources, such as tourist bureaus and civic groups. Libraries, police stations, welfare agencies, and state departments are going to be data sources to measure the function. Okay. Dimension of the place would be measured with stuff like maps, newspapers, and the local housing office. So we see the different dimensions. Politics, education, recreation, economics, and religion are all going to be looked at during our community assessments, right? We have active versus passive partnerships in the community. Active means that you're going to be actively involved in something. Passive is kind of like when you're not actively involved in the community. So, example of an active partnership would be more like a business that provides low-cost snacks to an after-school program. So, see, they're active in the community, right? They're going out to the school. They're providing them with some low-cost snacks. A city creating a new park, a hospital providing a vaccine clinic, and a recreation are all passive because these are all things that you would expect them to do, right? They're not doing anything above and beyond. We had a section on data gathering and data collection. So do you know that data generation is the process of identifying data that is not able to be looked at, but you have to look at the interactions within the community. Examples of this would be like the community's values and beliefs, right? So we're getting this information from the social norms that we see. Data gathering is more easy where you're collecting information like how old are they, what's their racial distribution, like what health organizations do we have. So difference between generation and gathering. Okay, so gathering is just getting the information that's there. Generating is you really have to go out there and find it. And here I emphasize again, examples of data generation are something you cannot get in a book. So it's like community values, beliefs, and social norms, okay? We take a look at everybody did their vulnerable population project due next week. That was with a windshield survey. And with that windshield survey, we collected data by riding around in a car, looking out a windshield, right? Nurse needs to understand that the community boundaries, you have to figure out where you're looking before you go looking. So population size, socioeconomic equalities, and government structures can be seen this way. Or we take a look at evidence-based practice. We know that this is a cultural change in practice. It provides an improvement to our healthcare basis. Okay. First step is going to be recognizing the current status of the practice and believing that there's changes that can be done, right? Barriers to adopting and implementing new technologies. What do some nurses say when we're going to do something different in a facility because it's evidence-based? We found that a computer system is better. What are they going to say? No, I don't want to use that. I like the old one. So you're going to have to make sure that there's some willingness to embrace the evidence-based practice among your peers. implementing research and current evidence, and leadership and attitudes when we're implementing evidence-based practice change. Okay. Evidence-based practice change is going to be seen in our nursing field. All right, disasters are labeled as natural or man-made. We had that chapter this week. Natural events are things that occur naturally, and then we have man-made ones like warfare, water supply contamination, pollution, right? Those are all things that humans do. So that's going to be man-made. We had disaster kits that we talked about. Make sure that with your disaster kits, the nurse is going to make sure that the family has enough food for 3 days, reviews the kit every 6 months, and ensures that all members know where it is and learn how to turn utilities off. In my class, I talked about turning off utilities if there's a gas leak, if there's a fire, if you don't turn off the utilities, you have further damage, right? Mass casualty scenarios. Our purpose in this is to see how quickly can it get done and how can we improve it. So think of our fire drills, our evacuation drills. The purpose is to see how can we, how much time does it take to do? And then how quickly can we get through it and do it effectively? Because the quicker you can get out of a mass casualty, the better. We took a look at proactive and reactive. I'm going to skip that slide because I don't think you guys need to know that. We had a chapter on teaching and educating. Remember, when developing community-based programs, you have to determine who are you teaching to before you teach, okay? Because if you're teaching to 5-year-olds, that'll be different than you're teaching to 50-year-olds. All right, then you identify the issue that needs to be taught. Select the learning theory as a framework, and then choose your teaching strategies. Okay, you all know we have our 3 domains of learning. We have our cognitive, our affective, and our psychomotor. Cognitive is the brain, so how do we learn with thinking? Affective is what do we feel? How do we feel about something? Psychomotor has the word motor right in it. That means you're gonna be moving, doing something like a motor. Okay. When our teaching is effective, we remember the teach back method. To remember if it's effective, teach back method focuses on having the client restate or demonstrate what was taught. When teaching a skill, the nurse should always have the client perform the skill to see if the learning was effective. Okay. So that's a lot about teaching. And then we take a look at differences in the comfort in learning. Remember who you're teaching to. So that we have several different generations, whether it's early childhood, like our Gen X's who like that technology and stuff. Our boomers, which is our big elderly population right now. So they're more like into the written material and things like that. Okay. So think about how all those different groups learn. We had a chapter on ethics where you talked about malpractice. In order for malpractice to occur, you must have a doctor-patient relationship. The doctor must be negligent. Negligence is going to cause harm or injury, and the injury is going to lead to harm. We take a look at liability, which is another way we can talk about malpractice. And we know that in this case, with malpractice, they had a duty to provide reasonable care. They didn't do it, and some sort of injury was caused, okay? So that correlates with your malpractice. Case managers, you had a chapter on case management. Case management's goal is to limit any of this from occurring, okay? They check on the patients, they follow the patients to make sure. We have several different organizations that help to guide us as nurses. We have the World Health Organization, which is going to do things like monitor drug reactions, have our standards for vaccines, provide information on diseases, and fostering collaboration. We have our CDC, We have our HRSA, which is our Agency for Healthcare Reform and Services. And we want to make sure that we know those different organizations. When we look at our case management, this was a chapter for this week. We know our roles as a nurse: coordinate long-term care, keep patients healthy and out of the hospital, coordinate doctor's appointments, determine the best treatment for patients, and schedule our surgeries. Our goal as a case manager, make sure your plans are individualized to each person. And in rural areas, a big thing that we'll do as a case manager is coordinate transportation, because remember, transportation is a concern in those rural areas. We're going to advocate for them with gathering data, exchanging information, and highlighting values. We're going to make sure that the nurse should report to the nurse case manager, is there anything in the home that requires priority interventions, such as airway breathing and circulation? So if somebody's on oxygen, you need to make sure that that case manager knows that, right? So that you can get that all set up for the patient before they get home and they don't have their oxygen. You guys had a section on infectious diseases. Please remember, vaccines are our most effective method of controlling and preventing communicable diseases, such as polio, diphtheria, pertussis, measles, which is now back on the rise because people have stopped giving the vaccine. So think about, in the United States, surveys show that a lot of times in our more inner cities or lower income families, they may not have as frequent access to preventative care, so they may not be getting their vaccines. Okay. Oops. Hold on one sec. Let me share again. What happened? Oh, there we go. All right, STDs you guys talked about in class, I hope. We have our bacterial, chlamydia, gonorrhea, syphilis. We have our viral, herpes, hepatitis, HIV, bacterial, easier to treat in the sense that you can give an antibiotic to it. Lyme's disease, you guys know, is a tick vector-borne infectious disease. See it in heavily populated areas. With our other STDs, you know, syphilis is the one that's transmitted transplacentally, and if untreated, can cause all kinds of harms to the babies. Okay. Which brings us back to vaccines again. We have some side effects that I want you to know. On our DTaP, it's normal to have swelling and redness at the site. And the reason you would not give a second dose of your hepatitis B is as if you have an allergic reaction to the first one. Okay. So if a parent calls and says they got DTaP yesterday and now they have swelling and redness, okay, no big deal. You just put ice on the spot. Okay. Surveillance systems, we talked about, you have passive and you have active surveillance systems. Active surveillance systems are going to rely on healthcare providers. And what we do is we have a nurse in our active one that's going to work for the health department. They're going to go out there and they're going to get the information for you. Passive is when the healthcare providers provide it to the health department for our surveillance to see what's going on in the community. Okay, so make sure you're familiar with both of those. We have surveillance systems. We just talked about this. Passive and active. I emphasize them. What's our purpose of observation and surveillance? Is to assess the public health status, look at some trends of disease patterns, set priorities, reduce mortality and morbidity by preventing and controlling diseases. Here's our outbreaks. We talked about the 4 different types. We have a point source outbreak, which occurs when people are exposed to a source resulting in each person getting ill. We have intermittent, when you're exposed over a period of time, people get sick, such like food poisoning. We have our mixed outbreak, when one person is exposed to a source, then person-to-person contact, like the flu. And then we have propagated outcomes, where there's not a common source and spread from person to person, such as TB. Remember, in our tight-lived areas, right? When developing a community-based program, nurses need to conduct a needs assessment. We're going to have to look at the pre-active stage. The nurse will project future needs. During the reactive, they're going to determine the problem that occurred using the past. And in the inactive stage, they're going to define the problem based on the existing health status. In the interactive stage is when we're going to be doing our problem used past data to project future needs. So that's going to be interactive. The past and the present come together. We always know our ADPI: assess, diagnose, plan, implement, and evaluate. And when we think about this, we're looking at program development. So we're looking at the sustainability and the ability for the program to meet objectives is based on the program's ADPI. Has it worked well? All right, quality improvement was a chapter you guys had this week. Please know that we're going to have quality assurance, which is focusing on accountability by fixing errors, having problems. So quality assurance is going to be when something happens and we fix it. No, it's quality improvement is going to be for more patient-centered care. They're the center of why we're making change. Teamwork and collaboration, make sure that we're effective with our nurses and interprofessional teams. Evidence-based practice is our best way to make sure that we are practicing based on past evidence. That's quality improvement. We use data to monitor the care process. Safety, we're going to make sure we minimize the risk of harm to patients. And then information with technology to correct errors. Quality improvement. Again, we know our first phase is a structure phase. During this phase, the nurse will determine if the philosophy and objectives align with our job descriptions. Before we make any changes, we got to figure out what do people do. That's our first phase that we do, and it's the structure phase. Then the nurse evaluates the quality of care by reviewing nursing care procedures and identifying professional procedures. And in the outcome, we evaluate the results of quality improvement by looking at how much more safety and health were our patients healthy. All right, we have our ethical principles we talked about: autonomy, beneficence, non-maleficence, justice, utility. Make sure ethical principles of respect for people focus on things such as obtaining informed consent, autonomous decision-making. Beneficence is about minimizing the risk. The way I like to remember that for you guys is benefit, right? Justice is the ethical principle that focuses on fairness around. Okay, so know your ethical principles very well. We have social equality. We have that feminine ethics, which advocates for equality among all, and virtue ethics, seeking to enable persons to flourish. Non-maleficence has the word no in it, so it's going to be no harm. And no, it's based on the morality of our relationships. When we think about our immigrant population, please think about the financial constraints, language barriers, social, religious, cultural differences. Family conflict can develop among our immigrants due to that change in environment and the challenges that we get. Remember, we have refugees, and our priority with those is to make sure they have access to therapy, to care. Okay. Often they've experienced some trauma. And so the priority for nurses is making sure they get access to care. Okay. Navigating public transportation can be a problem, and communication barriers can certainly be a problem with our refugees. And with our Native Americans, please remember those are our past oriented. This is a little cultural sensitivity chapter. And so they're maybe not concerned about the future. So if you ask them to make an appointment in 3 weeks, probably won't be done. So the nurse needs to make that appointment for them. Okay. We have our Amish culture, which could be a question about the Amish culture. So just know that they do natural and alternate treatments for are common. Church is very important. Organ and blood transfusion is not prohibited. And the male of the household is our head. Okay, any other questions? The rest is some math review, but I'm not going to do that. Any other questions on your study guide that I did not cover? There's a lot of content this exam.
You said that this PowerPoint won't be available to us, but will something similar be available?
So what you can do if you want to see this PowerPoint is just watch this. I'm sorry. Sorry, my dog is barking. Just give me 1 second. Sorry about that. I usually teach in my basement, but I haven't been able to because there's some allergy going on with my basement. Anyway, so yeah, so just watch this and you'll be able to see the PowerPoint. You know what I mean?
Thank you. Yeah.
You're welcome. And if you guys have any questions, I'm always available. Please feel free to reach out. My email is available through Fortis, and I will send this recording to your professors. Every professor will have a copy and they will post it for you, okay? Thanks for attending tonight. Best of luck on this third exam.
Thank you.
You're welcome.